Good evening, and welcome to tonight's CNN Report, where I'll be talking with Ian Rosenberg, an expert with the Environmental Protection Agency here in the U.S., and Jessica Blackburn, who's been working with the African Ministries Council on Water in Ethiopia. The Millennium Development Goal for the year 2015 has been to halve the population of those without sustainable drinking water. Ian, how has this goal affected the United States?
Well, the United States is a democracy, as everyone knows, run by the President Barack Obama. And since Barack Obama's second term, he has really wanted to revise the Clean Water Drinking Act that was developed in 1972. He is maintaining that he has many promises that he wants to fulfill that allows him to pursue new ways to protect public health. And the Millennium Goal helps him do that because it gives him a timeline for him to fulfill what he needs to be done before he leaves office in 2016.
Excellent. Jessica, from what I understand, Ethiopia is home to millions of people who do not have access to clean water. How has the Millennium Development Goal been able to assist Ethiopia with this social problem?
The Millennium Development Goal has really given Ethiopia something to start working towards. Exactly as it says, it's a goal that has been set really for the entire world. Ethiopia is home to around 81 million people. About 40% of the population have access to clean drinking water currently. The Millennium Development Goal is trying to cut that number in half to provide the people of Ethiopia with sanitized and clean drinking water. Currently, in Ethiopia, their government is a federal democratic republic. However, this is fairly new for Ethiopia. Their country has changed government several times. In 1995, they saw its last change when they became the Federal Democratic Republic, and they elected a prime minister into office. They do also have presidents, each state within Ethiopia. However, the prime minister really is the one with the power in the country. The issue right now with that government in Ethiopia, though, is the lack of advocacy. It's just really not prioritized in regards to sanitation and their health when it comes to drinking water. There have been many waterborne diseases because of the lack of sanitation, and this Millennium Development Goal has really just put a focus on getting that issue taken care of.
Very nice. Ian, what problems does the U.S. face in regards to sanitation and drinking water, and are there any policies or programs set in place to try to solve these current problems?
Well, the policy that was set in place, as I mentioned earlier, was made in 1972. It's called the Clean Water Act. And the Clean Water Act establishes the basic structure for what can be put in water and what cannot be put in water, as far as contaminants, carcinogens, and stuff like that cause cancer, because before 1972, a lot of things were being put in the water of the American people, which is why there was a spike in cancer at that time. The problems that the United States currently faces that we are working on with the Obama administration is more than 20% of the national water treatment systems have violated key provisions of this act. And Obama really wants to take this act and reestablish it and refocus it on the now, because it's kind of set back in 1972 as well still. Another problem is fracking. Fracking involves blasting huge amounts of water, sand, and chemicals deep underground to get natural gas and oil. And that is a very effective way to get oil, but it's also a very effective way to contaminate lots of water in a short amount of time. So the reason there's been a lot of debate whether fracking should be banned in the U.S., and Obama hasn't really stated where he stands on this, but it's not against the law currently, but there's a lot of restrictions on it. And as of right now, fracking is a very big environmental issue in the United States, also around the world as well, but mostly in the United States, because as there's been many YouTube videos on the news of people being able to light their kitchen water on fire. and that just shows how much contamination is in the water. So that's what we've been working on.
I see. Jessica, I'd like to ask you the same question in regards to Ethiopia.
Ethiopia faces, many problems in regards to sanitation in their drinking water. As I had mentioned, the advocacy just really is not there. There's not a lot of government support when it comes to sanitation for their drinking water, and there's a huge lack of education for the people of Ethiopia when it comes to sanitation and hygiene. There's, a high incidence of fecal matter contaminating their water supply, which then leads to high child mortality rates because of the bacteria that they're ingesting when they're drinking this water. And as I've said, there's not a lot of government support. So really, what we've been trying to do is I've been working with the African Ministers Council on Water. Is we've been working with outside sources, bringing them into Ethiopia to build infrastructures that will help keep the water more sanitized, things such as latrines, so that the people of Ethiopia have an alternative to using the restroom outside of their home, where they're less likely to be able to contaminate the water. The Health Services Extension Program is something that we've implemented in Ethiopia. This brings healthcare workers from places such as the United States over into Ethiopia to educate the people. And not only is this going to help them as far as the sanitation in the water, it's going to help their health, but there are many women who are suffering from lack of education, because that's their full-time job, is to go and retrieve water, and it's an all-day event for them. That is what they do, and so then their right to education is really taken away from them. If we are able to get the sanitation more under control, it would open up many doors for the women of Ethiopia to then be able to have the same opportunity as an education by going to school that the men in Ethiopia have. And we really rely on a lot of private programs from places such as the U.S. That fundraise for places experiencing poverty, lack of sanitation in their water, such as Ethiopia. So we, work with people in the Universal Access Plan and different programs within the U.S. and in other countries to bring in funds so that the people of Ethiopia have the opportunity to start getting the education that they need, building the infrastructures that they need, because really the government expects Ethiopian people to be able to buy the materials themselves, to be able to sanitize the water in their homes, and for many Ethiopians it's not an option. Most of them are living in poverty currently. So though there is some financial support for more public places, buildings such as schools, there's really not a lot of help for households themselves. So we really rely on that support from outside resources.
And that's really where the EPA comes in. We really want to send people over to Ethiopia and third world countries such as in Africa to establish a basis where human resources can be provided so people can learn how to keep the drinking water clean. The Obama administration is aggressively pursuing to protect public health by reducing contaminants in water, not only for the American people, but for the people of the world. And that goes back to the goal, the Millennium Goal. So.
What does the Millennium Development Goal mean for the world's population, and why is this goal so important?
Really, it means that each and every individual throughout the world is going to be given the opportunity to have clean drinking water, that they aren't putting their health at risk every time, they take a drink of water within their country. If you take a look at the universal rights for every individual in the world, you take a look at Article 25, which states, everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care, necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond his control. So essentially, this article is stating that every human has the right to clean drinking water. It's something that every human needs to sustain life. And so we are now trying to pull together as an entire world to make this possible for people currently living in poverty and people, or even in the United States who we may not be living in poverty, but there are, as you stated, many instances where
people don't have the access to clean drinking water because of things like fracking. And the EPA really stands with what Jessica and the African Ministry Council of Water is doing, because it means a lot to the people that they can have clean water, and clean water is the basis of life. Without water, there's no life.
So the Millennium Development Goal essentially is trying to get every country from the United States to Ethiopia to meet the water and sanitation requirements set by that country. In the United States, we see things such as the Water Act, where they spell out very cut and dry these requirements. In Ethiopia, we're still really trying to work on set policies. Right now, we've got goals in place that we're working towards, and with the help of our outside resources in the Millennium Development Goal, we're hoping within the next 5 years that this is going to be something that is pretty much taken care of.
Ian, Jessica, I thank you for coming in.
Thank you for having us.
This concludes tonight's evening news. Look forward to the story to develop more. If you're interested in donating and learning more information, stop by the website. God bless America.